Hello, I'm Grant Archibald. I'm the Chief Executive of NHS Tayside, and I want to take just a few moments of your time to tell you about some of the major achievements we've made already in our response to COVID-19, the coronavirus. There are four things I'd like to tell you about. The first thing is you will understand that we were trying to create additional bed capacity within our hospitals in order that we could take in those patients requiring to be treated for coronavirus. Well, we've been very successful in doing so. In only 9 days, our clinical and managerial teams have essentially created a hospital within a hospital at Ninewells, a 290 bedded unit that will allow us to admit those patients with coronavirus into one part of the hospital. And importantly also, we have doubled the number of critical care beds we have available across Tayside, which again is seen as a major step in helping us address the coronavirus. The second thing I want to tell you about is the fact that obviously we still have many patients who require admission to hospital for reasons other than coronavirus. People who have been involved in emergency situations, require emergency surgery, or indeed are cancer patients. And as a result, we've created a business critical team who have been working to ensure that those facilities are available for those patients. I am very pleased to let you know that those arrangements have been particularly successful. NHS Tayside remains the best performing healthcare system in the UK in delivering emergency care. And by that I mean our performance against the 4-hour target for patients to be either admitted or discharged from hospital has been the best performance anywhere across the UK. That is testament to the very hard work of all our staff, and particularly those dealing with emergency admissions. The third thing I'd like to tell you about are our community assessment hubs. These are facilities we have created in localities across the Tayside area in order that GPs and colleagues can assess patients who are presenting with symptoms of COVID-19, the coronavirus, but don't require to come to hospital. This has been a major achievement and has been testament to the great working between GPs, the health and social care teams, and also hospital staff. We've created facilities at Perth Royal Infirmary, in Forfar, in Montrose, in Arbroath, and at King's Cross Hospital in Dundee. So again, I hope patients, relatives, people in the communities and our staff all appreciate our commitment to trying to provide services as locally as possible in these challenging times. The fourth thing I wanted to tell you about was the fact that NHS Tayside put in place staff testing, which allowed staff and their close family contacts to have the test for the coronavirus. We understand that we were the first health board in Scotland and indeed the UK to do that, and we wanted to do it to reassure our staff and protect them, but also to protect our patients. By the end of March, we had seen over 1,000 members of staff and their close relatives through that service. And through doing that and identifying those that were negative, over 500 members of staff were able to return to frontline duties. That is fantastically helpful. It reassures the staff and their families, but also importantly for our patients, it means that valuable staff with all their training are back in the front line helping us deal with the patients who are going to come in requiring our care. As a result, I am absolutely delighted that we managed to put this arrangement in place, and it is testament to the hard work of a huge number of staff in many different fields working together to make that possible. I'm sure everybody listening to this message will recognise both the size and importance of that scale of task. Finally, I would just like to reiterate my thanks to the public, of NHS Tayside area, to all the people working in all of the support agencies, in councils, in social work, in home visiting, and all of those working in hospital services. This is an immense challenge for us all, but we are all working together, and the people of Tayside have responded in kind by ensuring they're only presenting at hospitals and at other services when they really believe there is the need. That is a great effort on their part, and please, would you keep doing that for us? Our message remains: stay home, protect the NHS, save lives, and working together with you and all our staff, I am sure we will rise to what is clearly one of the most difficult challenges the UK, Scotland, Tayside has ever faced.